tendon problems on the kneecap or Achilles tendonitis. And what we do is under ultrasound, we have a needle and a surgical tool that goes underneath the tendon where the tendon, where there's a lot of vessels and arteries that are called neovessels that cause a lot of the pain for patients. And we actually separate the layer between the tendon and these vessels. And it's really great because we don't go through the tendon. Patients can go back to exercise and they can go back to work significantly quicker than some of the traditional procedures that we've done before. And so in this picture, this is what you can see. We put on this special imaging to see the ultrasound blood flow, and you can see that there's all these vessels that are causing pain near this tendon. This is the patella tendon here. And so with this instrument, under ultrasound guidance, we actually get rid of all these vessels and separate that tendon from the fat pad. And that's what causes a lot of pain for patients and contribute to tendonitis. And so this is a way for us to, and because we're not going through the tendon, there's not a long rehabilitation protocol. So for most patients for tendon scraping, they can return to work in 2 to 3 weeks doing a lot of activity. Additionally, there's one more person. Additionally, if we go through the tendon, it's usually a 6-week protocol that I have. This was my research interest at Mayo Clinic, and we take them from range of motion to strength to progressive return. But most people with some of the tendon treatments I do are back to work and within 6 weeks. So the next thing that we're going to talk about was invented at Mayo Clinic. It's called Tenex, which is called a percutaneous tenotomy. I do them in the surgery center, and we offer this for tennis elbow, golfer's elbow, so tendonitis on the elbow, patella tendonitis on the knee, Achilles tendonitis on the back of the leg, plantar fascitis, which happens to a lot of people on the bottom of the foot, and then for calcific tendonitis, so calcium deposits that go into the tendon. We'll go over some of the evidence and latest and some of the videos that explain what this is. So the basic mechanism of Tenex is what we use this tool to get rid of the unhealthy tissue while preserving the rest of the tendon structure. And this is from a science perspective. You can see how the collagen actually restores to normal when they look at it from a lab perspective. And Tenex now has been around for over a decade, and there has been over 35 articles published in many orthopedic journals showing its efficacy. And it has success rates of greater than 85%. So these are patients that did not do well with therapy, that are continuing to have pain and are limiting in their quality of life. And it can be a really great, successful, permanent treatment solution for them. And so this is what the inflammation looks like in tennis elbow. So you can see the tendons attaching the elbow, and they have, and this patient has some partial tearing and some inflammation that's happening in the tendon. And so this video will depict exactly what we do. So you can see we make a little stab incision after giving just some local. There's no general anesthesia. And then we take this tool and we go to the area of where there's injured tissue, and we remove the damaged tissue while preserving the rest of the normal tendon. And the damaged tissue will go into this tube. It works similar to how cataract surgery works. And it takes about 10 to 15 minutes to do in the surgery center. So a lot of patients ask, what is the evidence on some of these newer treatments? Well, there actually is some really good evidence. So this is a good study that came out of the American Journal of Sports Medicine, published by some of the doctors at Mayo who were part of creation of Tenex, and they showed 3-year follow-up on patients, both from an ultrasound, so imaging perspective, and from a pain and function perspective. And this is what it looked like. So this patient, the black area, they had some tendon tearing and a lot of inflammation. And then you can see the tendon healing at 3 months, at 6 months, and then 3 years. And then you can see their pain score went from a 6 to a 0 over the course of 3 years, but significantly improved over the course of several months. And then their function also improved similarly. This was a study done at Emory University that showed PRP, which we'll go over in a little bit, versus Tenex for tennis elbow and golfer's elbow, and showed excellent outcomes in both these procedures for improving pain function and their quality of life. A lot of people ask, well, how does this compare to surgery? And so this was a study that was done by skeletal radiology, and it showed that Tenex versus surgery, there was faster return and similar outcomes in the ultrasound guided approach versus the surgical approach.